February is American Heart Month, but in today's Health Alert, did you know that your oral health is actually linked to your heart health? And here to explain that is Dr. Samir Obaid, a dentist from the Oak Ridge Dental Center. Thank you so much for being with us
Thank you for
today.
having me, Alicia. Thank you.
We do appreciate it. I know you have brought some visuals for us here. First of all, I think a lot of people in general don't really think about their heart health also being linked to their oral health. Explain that.
Thank you for that question. So just please remember that gum disease, or what we know periodontal disease, is an infection. And so that infection actually means that bacteria and toxins will go to the general circulation through the diseased gum. So it's going to be available to the heart after that. And what we know for sure, it's been documented that bacteria and the gum disease will cause systemic inflammation, and that inflammation actually will cause the heart disease and other health issues. I know we're talking about the heart, but also it can cause a lot of other health issues.
What are the signs of gum disease?
The signs vary actually based on the stage of that disease. I mean, we can talk about redness in the gum, bleeding in the gum, swelling, abscess, mobility in the teeth. So it depends on the stage, but please remember, this disease is a silent killer, and the best way to discover it is just to visit a dentist.
Yeah, how often, how regularly should people be going to see their dentist?
In general, we tell patients twice a week, twice a year, but actually, you know what?
If you want to go twice a week,
you're welcome anytime.
But yeah, so every 6 months.
Every 6 months, but also a lot of patients, especially when they have the gum disease, they need to see a dentist every 3 months and sometimes 4 months. It depends on the stage of that disease.
Sure. Are there certain people who are more prone to gum disease than others?
Yeah, they are actually. But also, I just want to emphasize that #1 reason for that disease is bacteria. So lacking of good oral hygiene will cause that disease. But also smokers, there are genetic factors. And I just want to mention quickly before we leave is about a pregnant woman. You know, it's really important to know that gum disease has been linked to preterm low birth weight.
Really?
So it's really important for pregnant women to see a dentist before and during pregnancy.
So it's more than just flossing and brushing sometimes to fight gum disease?
Absolutely. I mean, 70% of success of any treatment depends on what patients do at home, but also it's important to see the dentist. There's no way you can actually discover that disease unless it's confirmed by a dentist, and to fight that disease, you have to see a dentist.
And if people would like more information or maybe even make an appointment with you,
of course,
how can they do that? Where can they go?
They're welcome to call Oak Ridge Dental Center in Rochester Hills, and
There's
perfect.
Info at oakridgedentalcenter.com. You can also get more information about Healthy American Heart Month on www.heart.org for the American Heart Association.
Thank you so much for having me.
Thank you for coming on, because that's a really good reminder that a lot of people don't remember.
Appreciate it. Thank you so much.